Welcome. On behalf of the National Transit Institute, I thank you for participating in the Transit Capacity and Quality of Service Manual Demand Responsive Transit webinar. The National Transit Institute develops, promotes and delivers training and education programs for the public transit industry in the United States. The webinar format consists of a presentation followed by a question and answer session. We are pleased to have Linda Cherrington and Buffy Ellis with us today. Linda Cherrington is a research scientist at the Texas A&M Transportation Institute and Program Manager for the Transit Mobility Program. Linda has over 38 years experience in public transportation, with experience in research, consulting, and as a manager with a regional public transit authority. She was a researcher for TCRP Report 141, Methodology for Performance Measurement and Peer Comparison, and was also a member of the research team that developed the third edition of the Transit Capacity and Quality of Service Manual. Elizabeth Buffy Ellis is a senior transportation planner with the KFH Group. She specializes in paratransit and transit planning and system design, needs assessment, and performance evaluation. She was the principal investigator for TCRP project B31/B31A on demand response transportation, Drt performance assessment and improvement, which produced report 124 on urban Drt and report 136 on rural Drt. Currently, she is the principal investigator for TCRP project 2, which is developing a resource for communities to improve transportation coordination and mobility options for veterans, military service members and their families. Now I will turn the presentation over to Linda.
Good afternoon. We're very glad to have all of you with us today. Just to give you a brief overview of the presentation today, I will briefly summarize the learning objectives, and then Buffy and I will be sharing in the presentation on each of the major elements of the presentation. I will be reviewing with you the quality of service, and Buffy will be talking about the Drt service examples and Drt capacity. You may hear us interchange throughout the presentation to help make sure that we have included all of the material that we want to cover with you today. Let's review the learning objectives. In today's webinar, you can expect to gain an understanding of the different types of demand responsive or Drt service addressed in the Transit Capacity and Quality of Service Manual. You will also become familiar with the manual's framework for evaluating Drt quality of service, and you will learn more about the factors affecting Drt capacity and existing tools for estimating that capacity. For those of you who may have used the second edition of the Transit Capacity and Quality of Service Manual, you will notice some important changes in the third edition. First of all, the material has been updated to reflect the variations on demand responsive service. We hope you will find this an important addition, and we'll spend some time describing and identifying the many different types of flexible transit service that fall between fixed route and curb-to-curb demand responsive transit. The second important change in the third edition is the fact that we've eliminated level of service numbers from the Drt quality of service tables. If you use the second edition, you may be familiar with level of service numbers 1 through 8. You will not see those today. Instead, we will be describing a different approach to measuring quality of service and using updated service measures that we hope will be helpful. And you will also find that the Drt capacity material has been completely updated, and it's given its own chapter in the manual. Before we get started, I wanted to emphasize a couple of caveats about the material. We will be talking with you today on each of the elements of demand responsive service types and then quality of service and capacity. And we'll cover those materials each independently. So with that, let me turn it over to Buffy and let her begin the discussion of the Drt service types.
Okay, thanks, Linda. Many of the users of the manual and also listeners today will be very familiar with the different types of Drt service, but it's useful to go over what we're talking about when we talk about demand response transportation. So Drt, or demand response transportation, is a type of public transportation that uses flexible routing and scheduling, typically small to mid-sized vehicles, to provide shared ride service to passengers' requested pickup and drop-off locations. In the early years, DRT was often called dial-a-ride service. More recently, it's evolved, and it includes a range of services that build on the inherent flexibility of DRT, but that also include some attribute of fixed route service, and these are called, appropriately enough, flexible services. And what these various DRT services share in common is a trip reservation, unlike fixed route transit where you don't need a trip reservation, and the services vary in how flexible they are, who they serve, and by their operational and performance attributes. So this is slide 7. This is sort of an interesting, fun slide. It shows the different types of service patterns, from many to many, where the DRT system picks up passengers from many different locations and travels to many different drop-off locations, to many to few, with many pickups, traveling to just a few destinations, many to one, and so forth. And actually, there are more variations than shown on this slide. For example, there's a few to one, just a couple of passengers going to the same destination. And there will be occasions where the DRT service is just one-to-one, like a taxi service. But, one would hope that this is not a frequent occurrence, because one of the important attributes of DRT is its shared ride nature. So general public DRT, this is DRT service that responds to requests from the general public. Routing pattern is typically many to many, could be many to few. Actually, it could be a whole bunch of things because it's flexible. Scheduling is typically could be immediate response. It's often advanced reservation, and sometimes it's a combination of the two. General public DRT can be appropriate for a lower density community where the trip generators are dispersed. It's also appropriate in rural communities, and it's actually in rural communities where you most typically see general public demand response transportation. But when the population density is more than around, say, 1,000 persons per square mile, and there's some linear pattern to that trip demand, sort of an informal rule of thumb we use is that you'd look to a service that has some aspect of fixed route or fixed schedule rather than just pure demand response service. Limited eligibility DRT, this is similar to general public DRT, but only certain rider groups are served. Typically, this would be older adults, people with disabilities. It's often called specialized transportation. In fact, that may be a more common term. Many of the rural DRT systems that you see originated as specialized transportation, and then they expanded to serve the general public when they began receiving federal Section 5311 funding. ADA Paratransit. This is the dominant form of DRT that you see in urban areas today following passage of the Americans with Disabilities Act in 1990, which requires that all fixed route transit agencies provide ADA complementary paratransit. Now, the law sets out what must be provided, and some transit agencies go beyond that and provide what we call premium service. And what the ADA requires is set out by 6 service criteria. The first is service area. ADA service must be provided within 3/4-mile corridors of bus routes and around rail stations, plus any small pieces that are within those areas. Response time. ADA service must accommodate requests from eligible riders that are made the previous day during regular business hours. ADA fares may be no more than twice the base non-discounted adult fare for fixed route service. Trip purpose. There may be no trip purpose restrictions. All trip purposes have equal standing. A trip to the doctor is the same as a trip to visit a friend, as a trip for a recreational purpose. ADA service hours must be the same as those for fixed route. And then finally, there may be no capacity constraints, which means no waiting list for trips, no caps or ceilings on the amount of trips to be provided, and no patterns or practices of a substantial number of trip denials, late pickups, or excessively long trips as measured by travel time. And it's this last requirement under capacity constraints that's been one of the more difficult ADA mandates to meet for transit agencies. It means the provider has to ensure that ADA service achieves high standards for on-time performance, for onboard travel times, and for telephone availability for trip reservations. Human service transportation. This is advanced reservation DRT service for clients or users of human service programs. Typically, this would be older adults, people with physical or intellectual disabilities, lower income persons, and so forth. and it provides access to meet the primary mission of the Human Service Agency, whether that's healthcare, adult daycare, job training, and so forth. Human Service Transportation is an ancillary service. It really supports the agency's main mission. And agencies do this in different ways. They may purchase transportation from providers, they may purchase vehicles and operate the service directly themselves, or they may help clients use public transportation, or they may use a mix of these. The GAO has identified more than 60 federal programs that fund some type of human service transportation, and the coordination of that service has been a topic in our industry for more than 30 years. The FTA requires a locally developed coordinated transit human service transportation plan. That's kind of a mouthful. This is a requirement that was part of Safety Lou legislation, and it's being carried forward with MAP 21. Flexible transit services. As I noted, these are variants of DRT service that have evolved in recent years. There's a really good TCRP synthesis report 53 that addresses these, and it's categorized them into 6 groups, which essentially run the continuum from the most flexible of these to the least flexible. The first group is DRT connector, probably more typically called feeder service. This is more DRT than fixed route, where there's traditional DRT provided within defined service areas, but providing time service to one or more points, such as a rail station or a bus transfer stop, hence the feeder notion. The second category is zone routes. These are not very common. It's a combined DRT service within defined zones along a corridor, and then there's scheduled departure and arrival times at one or more of the endpoints. The next 2 categories are point deviation. This is actually, I think, more typically called checkpoint dial-a-ride. Here, DRT service is provided within a defined service area, but are also scheduled stops at defined checkpoints. Route deviation. This is the most common of the flexible transit services, with service that's provided along a fixed route, but there's flexibility in the schedule so the vehicle can deviate off the route, typically for a defined distance, to accommodate a passenger pickup or drop-off. And the key to this is the balancing of this flexibility, this ability to go off-route, with a route where the travel times are not overly long, because there are some riders who board and alight at regular bus stops, and you don't want to make it too inconvenient for them. Flex route service is very common in rural areas. There was some data we looked at recently that found almost a third of rural transit systems operate some type of route deviation service. Then the last 2 types of flexible route segments, again, not very common. This is mostly fixed route service that converts to DRT for limited and defined portions of a route. And then the last category is a request stops. This is the least flexible, and it's really just fixed route service that serves a particular defined stop only on the request of a passenger. And then finally, we have jitneys. They operate on fixed routes without any fixed schedule or formal stops. You don't really see these in the U.S. They're often illegal because of competition with transit and taxis, but they're definitely common in developing countries. So now Linda's going to take over and take us into quality of service.
Great. Thanks, Buffy. Well, the quality of service section is one of the, we think, the most interesting and hopefully useful elements of the new manual. The concept of quality of service really reflects the passenger's perception of the service offered and the service delivered by the transit agency. Evaluating quality of service is an important activity for any transit agency because it measures things that make a transit service attractive to existing and potential passengers, as well as things that can help build community support for a transit service. So clearly we focus on how to measure what matters most to the customer. And we think of 2 major elements. One is service availability. Does the individual have access to transit? What options are there? And the second is comfort and convenience. So if you do have transit as an option, would you want to use it? At the same time, the ideal of quality of service from a passenger's point of view may not always be the best for use of limited resources by a transit agency. Therefore, transit providers need to balance the quality of service they provide with the resources they have available, using their policies, their objectives, their standards as guides to achieving that balance, and that's the kind of guidance that we hope this section of the manual will provide. As you're going to see in a few minutes, the quality of service framework that we offer today takes into consideration both the passenger point of view and the perspective of the transit provider. So let's talk a little bit about the quality of service framework. The framework presents key performance measures that can be used in setting service standards and evaluating the quality of service delivered to passengers. Quality of service framework considers 3 measures for availability of service. And those are response time, service span, and service coverage. There are also 3 measures of comfort and convenience, and those include reliability, travel time, and no-shows. We're going to talk today about each of these measures in turn, and for each measure, we will show you a quality of service framework that considers the different levels of service from the perspective of both the passenger and the service provider. So let's get started and see how this works. We want to provide a couple of caveats about the quality of service framework. First of all, it is intended to be applied to the general public or limited eligibility demand response services. This does not apply to ADA complementary paratransit. The federal regulations governing ADA paratransit stipulate specific service criteria that establish required levels of service for those riders that are AD eligible. Therefore, these quality of service suggestions do not apply to ADA but can be used for general public transportation or for limited eligibility.
So Linda, let me just interject here for a second. This is a very important difference between the 3rd edition of the manual and the 2nd one. In the 2nd one, we basically tried to shoehorn in ADA paratransit, and it just didn't work. So it just made much more sense to separate it out. So this quality of service framework is really not intended for ADA, and I think that's very important to remember.
Thank you.
Sorry, Linda.
That's good. That's a good point. So the first element of the quality of service framework that we want to talk about is a measure of availability, and that's response time. Of course, response time is important because it measures and defines how far in advance an individual must schedule a Drt trip. The response time is measured as the minimum amount of time that a rider needs to schedule and access a trip, or the minimum advanced reservation time. There are a few transit providers that also stipulate a maximum response time. In other words, how far in advance could you schedule a trip? Now, the response time quality of service includes 7 service levels. And as indicated in the slide, the guaranteed service area is typically a standing order service. It's included and represents a very high level of service. The rider sets a schedule and can anticipate that service will be delivered each time required based upon a preset standing order and its guaranteed response time. Now, there are also 6 other levels of response. First of all, same-day service, so that a passenger can make a spontaneous trip by reserving the trip on the same day. And then each subsequent level of service is a distance response time. More response time is required. By the time you get to the last 7th level, this requires a more than 1 week in advance schedule, and so it does mean that basically you can't plan a spontaneous trip. You have to plan well in advance. Now, the way that the quality of service framework is structured, I'm going to try to describe to you the table at the bottom, and if you happen to have your manual or have already downloaded Chapter 5 in the manual, you can find the complete response time quality of service table beginning on page 548. The way that each of the quality of service tables is structured for each of the criteria is, first of all, each of the levels is in the vertical column in the far left. You see here just one example, same-day service on a space-available basis. There would be 6 other vertical criteria. And then each column addresses whether or not it's a passenger-related quality of service measure or a transit provider consideration. So let's just take the one that we're looking at as an example. This is illustrating same-day service on a space-available basis, the second level under response time, quality of service. And in the next column, it's providing considerations for the rider. So this response time provides riders the opportunity to book a same-day trip if space is available, and it may be adequate service if trips are last-minute and not time-sensitive, and requires riders to be flexible if there is not a time open or if there's a trip turned down. So those are both the positives and the other considerations for quality of service. On the far right, these are considerations that come in to play for the transit provider. And that is, it allows the same-day service allows the provider to use capacity that otherwise might go unused if you only had advanced trip reservations. However, it requires the provider to have a control center staff that can continually monitor service and watch for slack time in driver schedules when additional trip is inserted. So you'll see that under each of the quality of service tables, we're providing considerations that you must have both as a provider and then for your passengers. And we're going to give examples on each of the additional measures that we're going to look at today. Let's move on now to the second criteria that we want to talk about, and this is service span. So the service span is measured both in the days per week that service is provided and the hours in a day. Now, obviously, these vary for different demand response services based upon the resources that a transit agency may have. Limited resources may mean that service is operated only for a few days during the week or it's a limited availability during the hours of that day. So it's particularly important to take a look at this, especially in small urban communities or rural areas where service is not provided on a weekly basis or even every weekday. And as you might well be aware, as the number of days of service decreases, demand response service becomes more of a lifeline service. And as the number of hours decreases, the trip purposes you can use for transit decrease. And there's a requirement for pre-planning to be able to make the trip. So if we look at the days of service, here are the 5 service levels for quality of service for service span on days of service. Service is 7 days a week, 6 days per week, 5 days per week, which is the minimum required to serve a regular work schedule Monday through Friday. And then, of course, limited service, less than 5 days per week or less than weekly. So in the example of a quality of service framework that is shown, this is giving the example of 5 days per week service. And the passenger perspective is that this will allow trips to work for a traditional work week. And it permits trips for full-time weekday employment and or education, and can usually provide access to most medical service. So this is a very good quality of service because it does allow you to focus on work and education trips and most medical. From the transit agency perspective, it's good for the community and it generates good support. But it requires operating funds to make sure that you can operate 5 days a week. And it really is a minimum level of service to attract choice riders, because you would want to operate more days per week if you wanted to provide service trips for choice riders. We're then going to take a look at the other element of service span quality of service, and that's the hours of service. The quality of service framework provides 5 service levels in this case, as indicated on the slide. The highest level is 16 or more hours per day, and then there are 4 additional levels. The lowest level is less than 5 hours per day. The example that we've shown here is the second to last service measure. It's looking at service that's provided 5 to 8 hours per day. Now, this allows opportunity to use demand response service for things like essential shopping or some medical appointments, perhaps to get to some part-time jobs. But it really requires pre-planning, and from the passenger's perspective, you have to make sure that you can schedule your trip within that window of time to go and return from your necessary transportation errand. From the transit agency perspective, this is a limited service for the community. It's really only acceptable if these are all the resources that you have to provide transit service. To provide a high quality of service, you would want to be providing additional higher levels of service is indicated in the quality of service framework. The next element of availability that we want to talk about is service coverage. This measures the geographic area where demand response service is provided. Now, many transit service providers, especially rural providers, offer a demand response trip throughout the jurisdiction as opposed to fixed route only on specific routes and specific stops. However, there are many instances when a service provider can only provide service in some areas on some days per week, so there has to limit the service coverage as well as probably the service span of service. Now, we did not provide a separate quality of service table for this measure, but we have provided an example of how an agency might communicate this service quality element to the customers and potential customers. This is a diagram of a service coverage map, and it shows 3 different levels of service in one county. The yellow area, which is a community toward the lower end of the map, has service Monday through Saturday. So the service coverage is addressed by the span of service, Monday through Saturday. Then the stops that are in blue are provided service only on the 1st and 3rd Thursday, and the stops in red on the 1st and 3rd Fridays. So clearly these are very limited service coverage options that the map provides information to improve the quality of service for the passenger because they can understand better when service might be available and know what to expect. Now, we've covered all of the elements of the availability category for the quality of service framework. Let's now talk a little bit more about the category under comfort and convenience. And the first measure we're going to address here is reliability. A critical measure of service level from the passenger's point of view is, can I count on the service? Will I be able to reserve a ride when I make a call at the time that I want to go? And can I expect the driver to pick me up on time? And can I expect the driver to get me there at my appointment time? These are very critical elements of reliability and perhaps the most important in the quality of service structure. Because of the nature of demand response, with all the different steps in the process, reliability really is a lot trickier than it is for fixed route. There has to be available capacity for the request. The window of time has to go into effect so that you deliver the service within a window that's specified, and there often is variable travel time based upon shared ride transit service. So we look at reliability in a quality of service framework in 2 elements. One is on-time performance, and the other is trips turned down. Remember, this is not ADA paratransit. This is demand responsive for the general population or limited eligibility, and so it may be the case that trips are turned down if there is not sufficient capacity at the time an individual wishes to travel. So the first measure that we'll take a look at is on-time performance. This measures the degree to which demand response vehicles actually arrive at the scheduled time. And it's usually calculated at the pickup end of the trip, although some transit providers also calculate on time for delivering the passenger at the appointed time on the destination end of the trip. Now, in demand responsive transit, the pickups are defined by a time within a window. And the most often window for urban demand response is usually 30 minutes, although your agency may have a longer or a shorter window of time in which you schedule trips and you try to meet on-time performance. On-time performance is typically measured by the percent of the on-time trips. So this is a table that illustrates the quality of service framework for on-time performance. And 5 levels of service are proposed. 95% on time or better, that's the percent of trips delivered on time within the window of all trips provided. And then the other steps in the 5 service levels go down to 90 to 94, 80 to 89, and so forth. Now the illustration is showing you the slice of the quality of service table that's in the manual for on-time performance. And this is looking at 80 to 89.9% on time. From the passenger's perspective, this means that you can usually rely on the service to be on time, but there may be exceptions. And if you regularly use demand response transit and your service is 80% on time, that means you can typically expect that you're going to be late 8 trips a month. So you think about what does this mean in quality of service for that passenger and for another passenger that you may be encouraging to use transit. If a rider has a time-sensitive trip, they may consider this level of performance as unreliable, and they may desire a service that is 90% or more on time. From the transit agency's perspective, you have to say, why is my service 80 to 89% on time? Why not higher? And it may mean that there needs to be more training for the scheduling or dispatch staff, or the drivers need to be more familiar with the policies and procedures for on time. And if a service falls below the 80% range during some periods of time, then you could risk an increase in passenger complaints, and you particularly could be dealing with some difficult trips that may be time sensitive. Now, the other element of reliability is trips turned down. This is a measure of the degree to which a passenger can obtain the service they want at the desired time or at a negotiated time that is acceptable. And it's calculated as a percent of service requests that are turned down due to the lack of capacity. It may be that there are trip turns down based upon an unusually high demand on a particular day or time of day, or if there's a shortage of resources. Perhaps not all driver positions are filled. Now, the frequent trip turndowns may mean that you're not providing sufficient capacity to the demand that's required for the service you offer. And it may be that you need to, as a service provider, need to look at more of the elements of how you're providing the service, driver schedules, the types of incentives you use to encourage passengers to travel at times that are not at the peak of your travel demand and therefore exceed capacity, or you may need to look at other operational changes. Now, the structure and the framework for trips turned down in the Quality of Service Manual, there are 5 service levels. 0 to 1% is the highest level of service, and greater than 10% trips turned down is the 5th and lowest level. The example that we've shown is looking at 5 to 10% of trips turned down. Now, the middle column addresses what the passenger perspective is for this 5 to 10%. The rider may need other options for trips that they really need if they might be turned down 5 to 10% of the time. For a frequent rider, that may be that they could be turned down 2 to 4 trips out of an average 40, and that may be more than they're willing to tolerate and continue to use this form of transit. From the transit provider's perspective on the right, this risks riders with other transportation options going on to use another type of service, or it may generate a lot of discomfort or consider that their service is not adequate or not quality of service and may generate complaints.
So, Linda, let me just interject here. One of the things on trips being turned down, this could be during peak periods, and actually when we get into the capacity part of this presentation, I'll talk about a particular model that looks specifically about how you can address peak period demand by using non-dedicated service. But it's not atypical for demand response programs to experience a lot, excess demand during peak periods, and if you're using only dedicated service, that can be a problem. Okay, sorry, Linda.
No, good point. Thank you. We're going to move on then and take a look at another element of comfort and convenience, and that is travel time. In demand response, you look at the time it takes to travel from your pickup to your drop-off for a demand response trip. And typically, a rider and someone who is evaluating this quality of service will compare the travel time for demand response to an exclusive ride, that is, that you're not ride sharing. I think an important point to make here is that a demand responsive transit trip is intended by design to be a shared ride trip. That means the passenger can expect that they may be stopping to pick up or drop off other passengers and they may share their trip. But that, of course, has the impact of actually increasing travel time. And so it's important to consider the passenger's point of view, that what can they expect to be a reasonable travel time as compared to if they were to be picked up and dropped off in a personal automobile or by an exclusive taxi trip. And the Transit Quality of Service Manual provides guidance on sample size and using other details that you may want to refer to. In this illustration, we're taking a look at the framework for measuring 5 different service levels for travel time quality of service. And the highest service level is an assumption that your shared ride trip on demand responsive transit is the same time as an exclusive trip, but not more than 25%. So it's a direct trip with limited ride sharing, and that the distance and the time is no more than 25% longer than an exclusive trip. Now, this provides a high quality of service. It doesn't delay the rider, and it increases the direct distance for trips. So, for example, a 30-minute trip would be increased to no more than 8 minutes. It would be a 38-minute trip, a high quality of service. From the transit agency's perspective, this may limit the amount of ride sharing. It may therefore reduce productivity, and although it may happen from time to time, the transit agency wouldn't expect this quality of service to be typical for shared ride demand response. And in fact, it may mean that you're not making maximum effectiveness of your time, that you need to improve productivity by increasing the passengers' revenue hour. It also, of course, has the impact of increasing operating costs per passenger trip. So this quality of service, while superior for passengers, has some real considerations that must be evaluated for the impact on the transit agency. The next element of comfort and convenience is a measure of no-shows. Now, no-show occurs when a passenger fails to show up for a scheduled trip. From the passenger perspective, who is riding transit, this affects their quality of service because the passenger is already on board and the vehicle is wasting time to travel to pick up someone who doesn't show. It increases travel time, and their perception is it's wasted time. And from the transit agency's perspective, it reduces productivity and increases operating costs. So we want to take a look at some measures for no-show quality of service. In the manual, we suggested 3 service levels for no-show: less than 2%, 2 to 5%, and greater than 5%. So this is a quality of service measure for the passengers and what your percent of no-show might be. So the example is looking at the middle level, 2 to 5%. So a passenger who is using transit may experience an occasional trip where another passenger doesn't show. And a frequent rider who is riding maybe 40 one-way trips in a month could be inconvenienced at this level of service 1 or 2 times during an average month. And that's a pretty high quality of service. From the perspective of the transit agency, any no-show percentage may have a negative impact on operations and lower your productivity. And so you want to always monitor no-shows in order to try to mitigate that impact. You may want to adopt a formal no-show or cancellation policy with some appropriate penalties, and you may want to provide more information to your passengers about the importance of showing up for a trip or calling ahead in time to cancel the trip. And this may also mean that you may want to isolate individuals who have frequent problems with no-shows to try to understand their situation and provide suggestions or help to improve that experience. So we've completed looking at each of the suggested measures for quality of service under both the categories of availability and comfort and convenience. And we think that this structure that we've outlined, the framework for quality of service, could be helpful for transit agencies to develop service standards and apply some of these quality of service measures to actually evaluate your performance, and also to identify the need to take initiatives to improve quality of service or to balance quality of service with your commitment of resources. I think it's an important point to make that for every transit agency, this is not a black and white, you're either high quality or not. Each one of these elements requires that you look at it for the particular service environment that you operate demand responsive and the resources and the customer base that you're serving. And we hope this is helpful to you in applying it to your own area. So I'm going to turn the webinar back over to Buffy to then address the capacity elements of the manual.
Okay, thanks, Linda. In terms of Drt capacity, I guess the good news is that for Drt, it's not nearly as complicated as it is for fixed route. For fixed route, capacity deals with how many people and buses can move past a given location during a given time period under specified operating conditions without unreasonable delay. It addresses bus routes, bus lanes, and terminals. But for Drt, The question for capacity relates to how many vehicles and how many vehicle service hours are required to accommodate a certain passenger demand and a certain service area. It also relates to operating policies, such as the length of the on-time window, and it may relate to policies relating to funding. If there's only funding to operate, X number of vehicles, then that's obviously a major determinant of the capacity that you have. And like fixed route capacity, Drt capacity relates to the size of the vehicle in terms of how many passengers can fit onto the vehicle, both ambulatory passengers and those using wheelchairs and scooters. There are a number of factors that impact Drt capacity, and I'll just run through these. Ridership demand, clearly this is important. With more demand for the Drt service, more capacity will be needed. Passenger characteristics, are these riders general public? Are they older adults or people with disabilities? Is this an 8A complementary paratransit service? Peak period demand versus off-peak demand, we've touched on that. But like fixed route service, many Drt systems have strong peaks. You need excess capacity during those time periods. Unlike fixed route service, though, Drt generally doesn't allow standees, and of course standees help a fixed route provider meet its peak period demand. Service area size, all of the things being relatively equal, a large service area requires more capacity than a smaller one because the passenger trips will tend to be longer. Service area characteristics, things such as railroad crossings or bridges, anything that restricts access between different parts of the service area. These types of characteristics that delay travel will also impact capacity. Drt Trip Pattern, that slide with all the different colored red and green triangles. Many to many, many to few, all of that, those types of things impact capacity. Any Drt system that can group trips effectively, the many to few, the many to one, will require less capacity, again, all things being relatively equal. Operating policies are important. For example, if the Drt system has a short on-time window and high standards for on-time performance, this will result in less passenger grouping and a need for greater capacity. And then the last point on this slide, an 8A paratransit service cannot limit capacity. It must provide adequate capacity to meet the demand for service, and this is what makes it so different than other types. So the manual highlights 5 different methods for calculating Drt capacity. I'll briefly summarize these, but it's best to refer to the sources where there are a lot of details on these methods, and those are provided in the manual. So the first one, the analogy method, this is very straightforward. You would estimate the number of vehicles and service hours needed for the Drt system based on data from similar Drt systems operating in a comparable or similar area. Drt Resource Estimation Model. This was developed through TCRP research. It's documented in Report 98. It does include a software tool. And basically what this model does is it shows the trade-off between fleet size and the share of the ridership market that can be served for a certain level of service quality. So essentially, for a Drt provider, there's a trade-off between high service quality and cost, where cost is dependent on the size of the fleet and your operating labor. With more vehicles, for example, which is of course greater capacity, a Drt provider can serve more people, can serve a larger service area, or can serve the same service area with a higher service quality. Okay, the next model is the analytical model. This model estimates fleet size and system capacity along with performance measures for certain defined operating conditions. And what's useful about this model is that it considers the size of the on-time window, peak period demand, and the size of the service area. And again, on-time window, we keep coming back to that. The smaller an on-time window, the more it increases your fleet requirements, although of course it's very important from the passenger's perspective. The next model, the non-dedicated Drt service model. This is the 4th model identified in the manual. It focuses on how the Drt provider can provide capacity with non-dedicated service. That would be service provided by taxis or other providers that aren't solely serving the Drt agency's passengers. This model is also developed through TCRP research, and it's in Report 121. And this model is actually 2 models. The first is a driver and run optimization model that was developed with research, and the second model is the one I just described in the last slide, the analytical model. And so this model is very useful because it helps the DRT provider determine the best split between dedicated service and non-dedicated service. The last model identified in the manual is the rural DRT model, and what this does is it uses an economic constraint model and spatial data from the DRT system's service area. The basis of this model is the economic notion of diminishing returns, that is, the point at which providing a transit service to a larger area causes a decrease in the overall trip rate, which would be an inefficient operation. Model inputs include the ridership demand, operating cost, fare and fare subsidy, and the distance to stops. And the way the model does this is it measures the total distance from the vehicle garage to each passenger pickup location. That's done with GIS analysis. So the manual makes it pretty clear in the beginning that it's not intended to provide tools for estimating ridership demand, but because DRT ridership demand is so important for determining capacity, we want to make sure that the manual gives readers resources for doing ridership estimation, and we've got a number of these listed on this slide. I think these are all TCRP reports. So very useful resources. Okay, more information. The report is available in different ways. You can get it through the TCRP dissemination program. It's online. It can be downloaded for free. If you go that route, make sure your printer has a lot of paper because the document is really long. The TRB bookstore will also be happy to sell you a copy if you want to go that route. And then our last slide, acknowledgement. So credit is given where credit is due, and particularly to Paul, who was the principal investigator for our project.